for the last 6 years, and I'm almost done, very thankfully, with a PhD in mind-body medicine. And a lot of my focus on the mind-body medicine aspect has been with regards to pain and inflammation in the body, and sort of how to approach that in a very comprehensive and more integrative and holistic way. So kind of combining those two hats, and my dissertation research in there is also based on use of technology for self-guided education and positive behavioral change. So really, my two worlds just collided in a really perfect way.
That's awesome. I have to say this. I'm just going to be real here. For an orthopedic surgeon to go and do mind body, I get a PhD in this.
Yeah.
What was your revelation that made you shift or add to and enhance your traditional medical background?
Maybe it doesn't seem obvious to people, so I'll just say, when you're an orthopedic surgeon, what you do all day is sit around and listen to people talk about pain. And I love orthopedics; it's a fantastic field. But I found increasingly that I felt that my hands were tied, or that I was even ill-equipped at times to offer people what I felt they really needed. I thought that might be the case, but I was kind of waiting for my doctor to say it, because who am I? I'm not the professional. And they thought, I thought that maybe some of the stuff going on in my life may be contributing, but I wasn't sure. And I was waiting for someone to kind of validate that. But the patient doesn't want to be the one to throw it out there, because they don't want to seem like they're histrionic or crazy or whatever. And so they're waiting for the doctor. And when the doctor doesn't reflect, they go, well, maybe it's just like they know better. So maybe it's just, I need to just to do this. And so patients do have a lot of wisdom about themselves, their own bodies, their own symptoms, and kind of what's needed. And I think, being willing to tap into that, and even just affirm their own thoughts about themselves a lot of times is very powerful. And that kind of gets to some of like John Sarno's work too, like, just validating the fact that this is a thing that can happen, and, maybe it's happening to you. And a lot of patients will go, yeah, okay. And for some people that's enough. They just know that, okay, well, that actually, okay, there you go. And then, some of their pain actually gets better. So
How do you see this virtual reality being used to help people with pain?
the content that we're delivering not only is educational, so we're saying, okay, well, here's how your nervous system works. And again, we're putting you in a scenario where you're going to internalize that information much better than if we just start droning on with a PowerPoint presentation or whatever and put you to sleep. Those are kind of so it's education, it's desensitization, it's sort of untangling or rewiring the brain back to where it belongs again. And I've just not seen, I think I've just, when I saw the technology, and what we were going to be able to do with it, this particular application became really, really of immediate interest. Like, this is something that really speaks to my heart for having done the work I've been doing all these years and the study I've been doing. It's like, okay, overwhelmingly, it's kind of like, wow, I've never had a doctor ask me these questions before, or I had one that immediately like left my office, then posted on Facebook and tagged me in it, just saying, finally, a doctor who cares about me as a person and not just my painful part. And it's sad that has to be the outlier, but it's not. And I again, I'm a little bit of a defender of doctors in the sense that I think still most people they have their hearts in the right place. It's just we're not educated in the way, and we're in a system that doesn't really support really getting to know your patients and really spending that level of time and care and asking, all the questions, and really getting into the depth of the issue to show you that, yes, the choices you make in life, and not only that, but the things that happen to you that are completely out of your control can adversely impact your health and cause you to experience physical symptoms.